Alright, hello, my name is Kaylee. I'm a brief student nurse today. We're going to be taking a little bit. Can you tell me your name and date of birth? Kevin Smith, 11/13/02. Perfect, checks out. Patient appears, stated age. Patient's posture is straight and erect. Patient's mood is appropriate to situation. Patient's facial expressions are appropriate to situation. Patient's gait is smooth without limitations. Watching as she walked in. Patient's range of motion able to perform without limitations. Patient's hygiene is appropriate. Patient is dressed appropriately for the weather. And the patient's speech is moderate. Alright, your 4 words are going to be blue, dog, wheel, and phone. I'm going to have you repeat those back to me a couple times throughout the assessment. I take her vitals, they're all within normal ranges. And now we actually begin the assessment. So I'm going to check your head. Head is normal cephalic shape, hair is thick and evenly distributed. I'm going to do your temporal artery. Pulsation nerve +1. Have you open your jaw. Temporal mandibular joint has smooth range of motion, no clicking or palpitations. I'm going to cover your sinuses. Any pain? Any pain? No. Alright, and then we move on to we move on to the eyes, and then external eye structures. Brown, thick, and evenly distributed, and then sclera is white and glossy white, and then kind of put this down. Conjunctiva is pink and moist. We're gonna do pupils constrict equally bilat, and then I'm gonna look at this. Pupils converge and constrict. We're gonna do the 6 stages. I'm gonna have you follow this with your eyes. Move your head. Alright, cranial nerves 3, 4, and 6 are intact. I'm going to have you do some facial expressions. Can you smile, frown, puff out your cheeks, and squish your eyes really tight. Cranial nerve 7 is intact. We're going to do your ears. Anything? Right? Ears are symmetric bilat. I'm going to look inside. Obstructions. Alright, I'm going to look behind the patient. We're going to do the whisper test. I'm going to tell you a couple letters and numbers. I'm going to have you repeat them back to me. Alright. I don't know if she's singing that. But, alright, cranial nerve 8 is intact. We are going to move on to the nose. Or actually, can you repeat to me your 4 words? Blue, dog, wheel. Alright. The nose is midline and symmetric, no lesions. Where did I put that light? Can you tilt your head back? Nasal mucosa is pink and moist. No lesions, no perforations. Septum is slightly deviated. Can you plug one nose? Breathe in now. Alright, patency is good, no obstructions. I'm going to have you smell. Smell that? Oh god. Cranial nerve. Cranial nerve 1 is intact. Sorry. Alright, we're only going to move on to your mouth. Can you smile? Alright, teeth are white and midline, or straight. Gums are pink, moist, and have tight margins to the teeth. Buccal mucosa is pink and moist. Lips are pink and moist. Can you open your mouth? Hard palate is whitish, moist with transversal rugae. Soft palate is pink and moist. Can you stick your tongue out and say ah? Uvula rises midline. Can you stick your tongue straight out? Oh, the uvula is cranial nerve 10. No tremors. Cranial nerve 12 is intact. No indications for the gag reflex, which is cranial nerve number 9. So we will move on. And going to the neck, I'm going to palpate. Any pain? Okay. Trachea is midline, no abnormal lumps. Have you turn your head to the side? Other side? Up, down, your shoulder, and then I'm going to shrug your shoulders. Cranial nerve 11 is intact. I'm going to listen to her carotid artery. Don't forget. With the bell side. Yeah. So I'm sort of remembering several phase 8 is the layers. Yeah. Alright, so no brood present. Alright, and then I'm going to move behind the patient and listen to posterior lung sounds. So you're coming with me. Okay. So I'm going to start with the spine. Spine is straight and erect. I'm going to have you take in a deep breath. Lungs expand equally by lat, downward slope of the ribs. We're going to do tactile firmitis. Can you say gloomy? Alright, symmetric vibrations by lat, and now we're going to move on to the lung sounds. I'm just going to show you where they are. You would listen to a full inhalation, exhalation on each spot. Alright, no interstitial sounds, lung sounds are equal by lat. And now we're going to move to the front of the patient. Alright, can you repeat your 4 words for me again? Blue dog from you. Great. She is not demented. Alright, and now we're going to listen to your anterior lung sounds. And you will determine your rate and rhythm. She's breathing unlabored right now. Alright. Same thing with the back. One full inhalation, exhalation, but you're just going to listen. I'm just going to show you where it is. 1, 2, 5. Alright, rate is 16, unlabored. We're going to do skin turgor. Less than 3 seconds. Alright, we're going to do your upper extremities. Arms are symmetric by lat. No lesions present. I'm going to have you squeeze. Muscle strength is equal by lat. And we're going to do capillary refill. It's less than 3 seconds, which is good. And now we're going to do the breast maneuvers. I'm going to have you go like this, and like this, and squeezing, and then go like this, squeeze, push. Alright, so breast rise symmetrically by lat, no retraction present, so a further breast exam is not necessary. We're going to have you lay on the bed. Alright, we're going to do the jugular venous pulse. So I'm going to have lay you flat and have you turn your head up and to the left a little bit. Alright. So it is present, so we're going to rise the bed to 45 degrees and it should disappear. See, it is now gone, so that is good. And now we're going to lower the bed back to about 25 to 30 degrees. To about 35, 40, no, 25 to 30 degrees. Listen to the heart. First, we're going to do Heber thrill, which none is visibly present, and then we're going to do the apical pulse. It is not present, which is normal in some patients, and then we're going to listen to the apical heart rate for 1 full minute, but for time's sake, I'm just going to show you where. It is fifth intercostal space, mid-clavicular. And using that, you determine the heart rate and rhythm. And then we're going to do listen for murmurs using the Z pattern. I'm going to start with the diaphragm side of the stethoscope. Aortic, pulmonary, surge point, tricuspid, mitral, flip it to the bell side, mitral, tricuspid, urgent, pulmonic, aortic. No rumors present. Alright, and then we're going to lay her flat again. That is the wrong button. Sorry. Alright, can you lift up your shirt? Alright, abdomen's contour is flat, umbilicus is midline and inverted. We are going to auscultate the abdomen first because palpating can increase normal bowel sounds. There should be 5 to 30 a minute. For time's sake, I'm just going to show you where. Starting in the right lower quadrant. Alright, 5 to 30 sounds present a minute, and then using the bell side, we are going to listen for abdominal vascular sounds. There are 2 to the right of the umbilicus, 2 above the umbilicus, and 2 to the left. Alright, now we're going to palpate. Anything? Anything? Alright, no abnormal, nothing abnormal with the abdomen. We can cover that up. Do you have any difficulty urinating, burning, blood in your urine, rashes? Alright, no further perineal inspection is necessary. Now we're going to do the lower extremities. Legs are symmetric bilat, no deformities present, hair distribution is even, no lesions present. We're going to listen to the lower extremity pulses, starting with the dorsalis pedis, posterior tibial, and then the popliteal, which are all +1. Skin is warm. And then we're going to move down to the toes. Pretend the socks are off. We're going to just do capillary refill. Less than 3 seconds. Alright, and my patient is quite ticklish, so I'm going to firmly grasp the foot and hold it in place for the patellar reflex. Toes curl. And now we're for the other foot. Toes also curl. And then we're going to do the foot push. Muscle strength is equal bilat. Alright, you can sit up on the edge of the bed again. That was funny. Alright, so I'm going to have you close your eyes. I'm going to touch you in a series of places, and I'm going to have you tell me where I'm touching you. Yep. 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 Alright, and while you're keeping your eyes closed, I'm going to have you hold your hands. I'm going to have you tell me which hand I'm putting down.
My pointer finger.
Yep.
Is it my middle?
Yes. Alright.
Index? What's that? Your ring? Isn't the ring at the end? I don't know, my finger is my thumb.
Okay, and then...
My pinky.
Yes. Alright, now keeping your hands open, I'm going to put something in your hand and I'll have you tell me what it is.
A coin.
Yes.
It seems like a penny.
Exactly.
What's this?
Yes. Alright, and then I'm going to draw a number in your hand. I'm going to have you tell me what number I'm drawing.
8.
Correct. Alright, you can open your eyes now. I'm going to have you go like this. Good. And then go like this as fast as you can. Great. And then heel to shin. Both legs. Perfect. And then I'm going to do the patellar tendon reflex. Great on that one.
Oh my god. Oh my
That one was also good. Alright. I'm going to have you stand up. Alright, close your eyes. The Romberg's test. No sways present. You can open your eyes and sit back down. No further indications for a musculoskeletal assessment is indicated. I suspect no abuse. And no further mental status assessment is indicated. Can you repeat it forwards?
Blue dog wheel.
Great. She does not have dementia. And thank you for your time. Is there anything else I can do for you today? Nope. All right, I'm gonna wash my hands, and that's it.